We were standing on the steps when the first bomb went off. I knew immediately that it was a bomb. Never heard a bomb in my life. I knew immediately it was a bomb.
You could see the smoke, you could see people screaming, it was chaos.
My first thought, quite frankly, at that point was I wasn't at all worried that we would handle well the victims from the marathon. We have been so well prepared for that. We've practiced so many times with incoming numbers of casualties of all shapes, sizes, injuries, problems, etc., that I knew the institution would respond beautifully with that, but I was very concerned that this was just the beginning.
My patient partner last year, Carson, a teenager who had just finished lymphoma therapy, jumped in with me at mile 20, and we were running, having a grand old time, high-fiving spectators and talking about what we were going to do as we crossed the finish line. And we reached Kenmore Square at mile 25 and were stopped because of the explosions at the finish line. And at that time we really didn't know exactly what was going on. And then it became very clear. It was very, very emotional for both of us. Carson had just finished his lymphoma therapy and was really looking forward to finishing the job by crossing the finish line. And at the same time, I was also very concerned about the 100 runners on our team. I didn't know where they were. I didn't know how many were close to the finish line. And I also had family and friends at the finish line. So it was, as you can imagine, very, very chaotic.
The victims began arriving around about change of shift. So the morning shift, the 7 to 3, and the 3 to 11, everybody was in-house. Doctors, nurses, physiotherapists, administrators, clerks who restocked the room. We had immediate double coverage of the entire hospital, and nobody left.
Certain areas of the hospital take on roles that are not part of their day-to-day activities. And so the Blum Center becomes the Family Psychosocial Support Center. For the first 4 or 6 hours, it was constant. And we probably received somewhere between 1,000 and 2,000 phone calls. In addition, people physically came to Mass General. Some who actually knew that their family member was brought here, and some who were just looking for their family member.
Soon after the first day and into the first week and into the second week and into the third week, it was really the staff that needed the most support. The families and the victims themselves were surrounded with people. In fact, even though a chaplain was assigned to each one, it was hard to get into the rooms because there were just so many people surrounding them with their love and their care. It was the staff who really needed support. So one of the things that we did regularly throughout the hospital was form support groups. Many of them spontaneously on the spot. We'd go up on units and gather the staff together, maybe around the nurses' station, maybe in a conference room, and simply give people a chance to talk and express their feelings. In some cases pray, in some cases just be silent, and in other cases just inviting people to tell stories about what happened to them, what it was like for them. We also teamed up with EAP, and we also teamed up with social services to do that throughout the hospital.
The staff we have in police and security, we have a variety of missions. Obviously, the main one being to protect this institution and our satellite facilities. But our other real mission that week was to keep the calm, because people were watching us. People were really deciding if they needed to be scared, I think, by looking at us and seeing if we appeared to be in control. We had the governor, we had the mayor, we had the new director of the Secret Service, as well as the president, who was unbelievable with these patients whose lives had been vastly changed forever 48 hours before.
So some patients said, I don't want to see the president. I think that they were concerned about how they looked. Would they be able to rise to the occasion? But when the time got closer and closer, everyone wanted to see the president. There's always fun, right, in situations. One very wonderful patient, when the president entered his room, the patient said, "You probably don't want to be with me. I didn't vote for you. I'm a Republican." And I could hear the president say, "Today we're all Americans." It was very tender. It was a really nice moment.
And it really rallied people in a way that we're starting to realize the impact of what had happened. I think, the first day or two after the bombings, people who were survivors were just so glad to be alive. They weren't, the reality of how changed and perhaps challenging their lives were going to be hadn't set in yet. And it was starting to later that week. That was a real treat, if you will, and I think buoyed a lot of spirits that at that point were starting to lag.
The week after the marathon, we received, I'd say, over 300 calls to help and volunteer here at the hospital.
Here at the Blood Donor Center, normally in a 2-day period, we would see about 150 donors who would come through. On the days of the bombing and following the bombing, those 2 days, we did have about 500 donors that came through, which was considerably more than what we would normally have. I think it was definitely a way for the community to pull together, and that was really evident by the people who came to the donor center. And everybody was talking to each other and consoling each other and hugging each other, and it was really sharing stories and wanting to help and really expressing that we want to help people. And it was just as bad of a situation as the marathon bombing was, it was also at the same time a really wonderful experience for those who worked here at the donor center, because we did see that outpouring of love and support and the goodness and humanity that sometimes we don't get to see.
What an amazing place Mass General is. Not that we didn't know that before, but in a kind of disaster like this, which was longitudinal in some ways. It had 3 different stages. If you look at the Monday, Tuesday, the presidential visit, Wednesday and Thursday, and then the Friday lockdown, it was not something that ended in a few hours. So that kind of commitment and skill from staff in this entire institution was, in my opinion, unequaled, and again shows us why we are the hospital we are.
I think the number one thing that I remember is the heroic efforts, not by the physicians, not by the healthcare providers, not by the pre-hospital providers, all of whom definitely contributed volumes to the saving of the lives of all these people. But what I remember the most were the patients themselves. The patients were the real heroes, and the way they responded to the catastrophe, the way they recovered, the way they regained their lives, and through which the way they gave courage to everybody else was just amazing.
Last Patriots Day was certainly a test for this organization. I'm very pleased with how we responded. We learned some things that we could have done even better, and I think, although I hope nothing like that ever happens in this community again, and we're never faced with such a horrific situation in the future, we will be even better prepared than we were last year.
We should be very proud. We should be very proud, even in the midst of the pain. We all had a front row seat to a piece of history. And I suspect a story that we never thought we would be a part of. But we trained for this. We trained for this, and I think we did our community proud.